My name is Noel Mendes, and I live in the Philadelphia area, not too far from here.
What kind of work do you do?
I work right now as a personal care attendant. That's the name they gave to us recently,
Mm-hmm.
with some changes that the state made to direct care workers, home health aides, and companions. And what I do is I provide assistance and care to my patients on a daily basis,
Mm-hmm.
from getting them up in the morning, out of bed, showers, breakfast, shaving,
Mm-hmm.
feeding them,
Mm-hmm.
and companionship, interacting with them, and just making sure that they're able to remain as independent as possible in their own homes,
Mm-hmm.
and that they enjoy basically what's the last days of their lives.
Mm-hmm. Um, how did you get involved in the Pennsylvania Direct Care Workers Association?
You know, it's not something that I had planned, and one of the patients that I am with now
Mm-hmm.
is on hospice care at home,
Mm-hmm.
and every day one of the aides from hospice comes in to help me take care of him for about an hour, and her name is Peg Ankney,
Mm-hmm.
and she told me about this association, Pennsylvania Direct Care Workers, and I thought about it for about 15 seconds, and I said, you know what, this is a godsend that Peg would come and tell me about this. So I immediately joined the association because I felt that, I have the ability and
Mm-hmm.
the talent to make a difference. And as I was explaining to someone recently, I said to myself, I'm not going to wait for the neighbor to come clean my bathroom. I'm going to clean it on my own.
Mm-hmm.
So why should I sit back and wait for other people to volunteer to run this association when I could be a part of it?
Mm-hmm.
So, I'm very glad that Peg introduced me to this association,
Mm-hmm.
and, look forward to doing good things with them.
Okay. And what do you think? The Direct Care Alliance is a national advocate for the direct care workforce, and we have legislation in Congress, the Direct Care Workforce Empowerment Act. You're going to join the Direct Care Alliance. Why do you? What do you find appealing about being a member of the Direct Care Alliance?
Well, the fact that they are a national organization,
Mm-hmm.
and the fact that they affiliate with the local state bodies like the
Mm-hmm.
Pennsylvania Direct Care Workers Association, also that they have people on their team who are able to train us and educate us on a lot of issues that we need to take the association forward.
Mm-hmm.
For example, meeting with our Congress people, going to Washington, and this legislation that there is right now that talks about um, the direct care workers um,
Empowerment Act.
Empowerment Act.
Yeah.
Thank you. That's something that I've always been concerned about, the
Mm-hmm.
benefits, respect, and recognition of direct care workers.
Mm-hmm.
And when I realized that this was part of the Direct Care Alliance's agenda, I said, this is some people that I would like to be working with. And I'm very thrilled about, what's going to happen over the next couple of months and years, um, in terms of how we're going to progress
Mm-hmm.
um, the issues for direct care workers.
What do you think? What are the most important issues for you as a direct care worker that you like to see change nationally?
Well, there are a couple of things. For me personally, and for a lot of my colleagues who I speak with, of course, the top issue right now is healthcare.
Mm-hmm.
Most direct care workers don't have healthcare benefits. Of course, the other pressing issue is their wages.
Mm-hmm.
Some of us have worked for close to or about minimum wage. Um, we are professional workers, but we
Mm-hmm.
are not seen as such. So respect and recognition
Mm-hmm.
is a very important to us as well. So between the healthcare benefits, proper salaries, respect, recognition, I mean, these are things that we're working towards, and I hope to see this happen in the near future.
Okay. And what would you like to say to other direct care workers in Pennsylvania
You know,
or across the country?
what I can say is, try to be open-minded and try to think about the bigger picture and realize that as difficult as it is for each of you, it's going to be so much better if we work all together hand in hand and make things easier for each other.
And getting workers together, you're doing that by creating a chapter of the DCA in Philadelphia, right?
Right, that's the other interesting thing that I'm, really fired up about, is that we are now in the process of establishing a Philadelphia chapter of the Direct Care Workers Association through the Direct Care Alliance. And I want to say thanks to the DCA again. And Philadelphia has a large concentration of adults, therefore it has seniors. It has a large concentration of direct care workers. So we thought it fitting that Philadelphia should have its own chapter in Pennsylvania to benefit the workers in the area and the workers in the state as a whole.
And you attended the Voices Institute training, which was funded by the Valentine Foundation in Philadelphia recently. How did you like
Right,
that?
that was the leadership workshop, and that was very interesting, very informative. I sat through the morning session